It is important for owners to know how to do simple neurologic tests because neurologic disease can be severe. It can be dangerous because some diseases are infectious and can affect other horses or people. And horses can become unsafe when they are neurologically impaired and can cause damage to people when they're handling them or riding them. So some of the obvious neurologic impairments a horse owner might see are things like abnormal behavior, lethargy. Sometimes it's severe in the fact that they cannot get up on their own, so they're recumbent. Other neurologic deficits you might see are horses that are unable to swallow. Sometimes it's abnormal carriage of the ears, the eyelids might be droopy, the whole head might be tilted. They might stumble or knuckle or fall. Those would be some of the most common neurologic abnormalities that you would see. So some of the tests that a veterinarian or you as a horse owner can do that are relatively simple are just watching the horse stand. When it's standing, you can find out where the legs are positioned. This is an example of a wobbler, a horse that has compressive myelopathy. We see in this horse that he has proprioceptive deficits, which means that when the horse is at rest, his legs are not standing square underneath him, and you can see that very clearly as he's standing here waiting for us to do something with him. His front limbs are base wide and they're pointing in a different direction than his hind limbs are. You can then also watch the horse walking back and forth, and you're looking for abnormal swaying movements or, as before mentioned, stumbling or knuckling. In this horse, we see that the horse uses 3 tracks to walk on. One is for the left front, one is for the right front, and then we have one track that is being used for the left hind and the right hind, kind of like a tightroper. The other thing you can see in this horse is that there's a significant amount of what we call truncal sway, whereby his hips excessively move from left to right. The other helpful test would be to do small circles with the horse in both directions, about 3 times one direction and then 3 times the other direction. You want to make sure that the horse makes a small circle, but the circle is still big enough that the horse can move forward. You don't want to just pivot the horse around you. And you're looking essentially for where the horse places its legs, whether it's stepping on himself, whether there's any interference, or whether the legs are picked up appropriately and then placed in a normal position. You could see that the horse does pivot on his legs inappropriately. He does step on himself. And also there's an occasional circumduction, which is an excessive movement of his hind limbs. You can do a tail pull test whereby you, number 1, check the tail tone and find out if there's appropriate tail tone. We usually want to come from the left side of the horse, lift the horse's tail up, and as we're lifting the horse's tail, we're finding out if the horse responds by flinching his tail back down, because that would be a normal response. A horse should not have a flaccid tail. That could indicate some level of disease. Once you are underneath the tail, you can look at the anus, and then you can either put a thermometer in the anus to get a rectal temperature, or you can just pinch the anus and find out if the anus contracts appropriately. That would be considered normal anal tone. And then you can find out how strong the horse is by pulling on the tail of the horse more strongly. And you can do this as the horse stands or as the horse moves. So for the walking tail pull, you will have your handler walk the horse away from you while you pull the tail one direction and you do it both directions. As you pull the tail, you want to start off by a light pull and then have a more strong, sustained pull, depending on how strong the horse is. Of course, you want to watch out, because if the horse is very weak, you don't want to cause him to fall over. You're watching for strength. A horse should not move much towards you as a puller. And you're also watching what kind of compensatory moves the horse makes when you are doing the tail pull, and also especially when you remove your pull. Another test you can do is just back the horse up. Normal horses, when they back up, should have a straight, flat back and should pick up their legs appropriately. But horses with neurologic disease often struggle with that and might dog sit or hyperextend their front legs or things like that. In order to perform the tongue tone test, I lift the horse's lip up on the left side of the horse's head and grab the tongue with about 3 fingers and just very briefly try to pull the tongue out of the horse's mouth. I do not want to yank the horse's tongue out hard, just a little bit, and that gives me an indication of whether the horse's strength is good enough to withdraw the tongue back into the mouth, It also gives me an idea of symmetry, whether the horse's tongue is symmetric. And if that is not the case, then diseases that contribute to some level of weakness, like botulism, could be a factor. Or there are other diseases that could be usually multifactorial if tongue tone is affected or other cranial nerves. In order to identify any abnormalities with regards to the cranial nerves, which are big nerves that come off the brain towards the head, you can do a menace response, which is essentially evaluating whether the horse blinks when there's a stimulus coming from visual input. I like doing that from 3 different directions, from the front, the side, and the back, because the horse's eyes are so big. And you're essentially finding out if the horse blinks appropriately when you bring your hand towards the eye. So you can look for presence of a sensation by putting your fingers in the ear, the nostril. Sometimes you can do a few pinches in different places, and the palpebral response, which is touching the skin around the horse's eye, to again identify if the horse has normal sensation around its head. Performing these tests are very helpful, but if there are concerns for infectious disease or contagious disease, you want to make sure that you don't move your horse outside of its stall into an area where it might expose other horses. So if you are concerned about neurologic disease in your horse, the best thing is to reach out to your equine veterinarian and get the horse assessed.